So thank you for asking me to speak today. I'm talking on behalf of the chapter writing group for maternal infectious diseases. I'm going to concentrate on lessons for maternity units, and this is mainly going to be around COVID vaccination. So just a reminder, you'll have seen this slide already this morning. Sadly, in this triennium, COVID was the leading cause of maternal death with 45 deaths. I should emphasise at this point that these are deaths where COVID was a major cause of death. They're not coincidental deaths. We did our first report on maternal deaths from COVID-19 in 2021. It was published in June 2021, and this covered deaths between June 20 and March 2021. You'll remember from that report that sadly 14 women died in pregnancy or up to 6 weeks postnatally, and 3 died after 6 weeks. This means that the majority of women who died from COVID died after vaccine approval. The State of the Nation report for perinatal deaths was published last month. I'm sure a lot of you will have read of this. Again, in this report, we had 351 mothers who tested positive for COVID who had a stillbirth. That means that nearly 12% of the stillbirths in 2021 were in mothers that tested positive for COVID. There are also 57 mothers of babies who died in the neonatal period who had a positive test for COVID. That makes up about 5% of the total number of neonatal deaths in 2021. So COVID had a big impact on both maternal and perinatal mortality, as well as morbidity. So how could we have prevented this? Well, one thing we need to look at is vaccine update. And as I said, most of the deaths occurred in women after vaccines were improved. In total, 27 women who died could have received 2 doses of vaccines. These women weren't against vaccinations, and we know that because they had received pertussis and flu vaccinations. Some of them just pertussis, some of them pertussis and flu. However, there was little evidence in notes that vaccines were discussed with these women or recommended. So what could have been done better? Well, just to take you back to 2020, on the 8th of December 2020, I think we were all really relieved when the vaccines were approved in the UK. However, anyone who was pregnant, breastfeeding, or planning a pregnancy in the next 3 months was excluded. And that was because those women had been excluded from the trials. This wasn't the case in other countries. In the USA and Israel started vaccinating all high-risk groups, including those that were pregnant, right away. It was only 3 weeks later when this decision was reversed and approval was given for use of the COVID vaccines in pregnancy in the high-risk groups. And then it was up to vaccine providers to start getting these vaccines, a process for these vaccines. And it was actually quite difficult because for other groups, there was a national SOP and a prescription wasn't needed. But if you were pregnant, you needed to have a discussion with a healthcare professional and each dose had to be prescribed. And it was really quite difficult to do this. In my unit, we went as fast as we could. It still took us a month to vaccinate anyone who was pregnant. And I remember being in the vaccine clinic. I was the doctor in the vaccine clinic on a shift in a very wet day in January when a member of staff booked an appointment, came in, and she was pregnant. She wanted a vaccine. She'd read all the approvals. She knew what she was talking about. And we actually couldn't give it to her because I didn't have any way of prescribing it. And she had to come back a couple of weeks later and get vaccinated, which fortunately she did. So in some areas there was a lack of urgency because it was difficult. And there was also a lack of confidence in the healthcare staff that were providing the vaccinations. I know for our mass vaccination centre in Manchester, a decision was made early on that they wouldn't vaccinate anyone who was pregnant, who was more than 20 weeks pregnant, because they were worried about what would happen if they fainted. Not quite sure why it was different to anybody else, but because staff weren't used to women who were pregnant, they took that decision. And it took till September 2021 to get that reversed. So just a recap of the vaccinations that are recommended in pregnancy. Well, you all know that we offer flu vaccine to every pregnant woman, following lessons learned from the swine flu epidemic. So we've been doing that since 2009. In 2012, pertussis or whooping cough vaccine was recommended to protect babies. So we give that to pregnant women from 16 to 32 weeks of pregnancy. And that's because that's the best time to make sure that the antibody is transferred to the baby to protect it till it can get its own vaccine. More recently, respiratory syncytial virus, RSV vaccine, has been approved in the USA in pregnancy. And that's not only a quality initiative, it's been shown to be cost effective. I don't think when this started I knew much about how vaccines worked, but it's clear from what we know about vaccines that they don't cross the placenta. They mainly stay in your arm, you make antibodies, and the antibodies will go to the placenta. There were studies on other vaccines before we got the COVID vaccine, but I've included a reference for anyone who wanted to look at it for a study that looked at COVID vaccines crossing the placenta. During the time that we were launching the vaccines, there was guidance from the RCOG and the RCM, and this got stronger as time went on. Twitter, or X as it's now known, is often somewhere where you get misinformation, but there's some really good information stores that are easily accessible to lots of people. And I think I have to mention Vicky Mayo, who's an immunologist in London, who is fantastic at answering questions, and she, on her pinned profile, tweet in her profile, has a Google sheet where she lists all the COVID vaccine trials. Very easy to access if you want to have a look. So here are some of the vignettes. Sadly, these are for women who could have been vaccinated but weren't. These women were all eligible for vaccination. Some of them asked about it or directed to other people, or were uncertain and no one went back to them. So sadly, they weren't vaccinated. It's not just COVID vaccines that weren't discussed with people. We also know that we also saw deaths from flu, but there was no record of vaccination being discussed, despite there being more confidence with that vaccine. This vignette of the woman who died following a pregnancy, and she had quite a complicated history. She was accessing care, there was a lot of input, but no one discussed vaccination with her. I think the reviewers recognised that although she died in a different flu season, had she been vaccinated against flu, it might have attenuated that illness and prevented her death. I've taken some clips from the BMJ and some newspapers just to remind you. I don't think I will ever forget this quote from Marion. She was talking about the uptake in pregnancy and how poor it was, how below it was other age groups. At the moment, I'm counting women dying every week. That was November 2021, 11 months after vaccines were approved in the UK. And I've taken some stories from people from the newspaper that you might recognise these stories of families that were devastated by the loss. And down here in the bottom right-hand corner, pregnant women moved to the top of the queue for vaccines. But look at the date, December 2021, nearly a year after vaccines were approved. Really, they should have been at the top of the queue at the start. So I just wanted to take you through as well some of the ICU admissions, just to show you where the peaks were. These are the UK ICU figures. If you look at the first, when we first got COVID in 2020 in March, there's a small peak here. It looks small in comparison to the rest. And people who were pregnant really weren't getting COVID very often then, because the kids weren't in school. People weren't mixing. People were staying at home, and so there was no opportunity. It then goes on and it increases over the course of the year. And then here we are in January 2021, where we have a big peak following Christmas mixing. The admissions go down again. We get to April, where we've now approved vaccination for everyone. It's been rolled out by age group. There's a low admission rate here, and then Delta hits. and all these unvaccinated pregnant women get sick and get admitted to ICU. It goes down after that, but look, you can see the admissions are still higher than they were in the first wave. I've just included this slide. One of my colleagues published this paper recently, just of some of the outcomes. I thought it's quite a busy slide, but I thought you might be interested in it. MBRRACE has produced this kind of data before, but I'm sure this reflects our experience of dealing with women during the pandemic. And unfortunately, I became very familiar, like a lot of people did, with ICU. And I'm glad I don't visit it as often as I used to. So the recommendations here, you'll recognise that these are new recommendations. These are from previous reports. And really, we need you to go back to your units and make sure that this happens. The first antenatal appointment, discuss and give information of immunisation for flu, pertussis, and other infections, and that now includes COVID-19. So we should all be doing that. Anyone who's eligible for vaccination who's planning a pregnancy should get it. I mean, we're now in a position where we're only giving boosters to at-risk groups. I think there's still an evergreen offer for people who haven't been vaccinated. So if people are pregnant, they haven't had a COVID vaccine, they can still get it. And remember, there isn't a time limit of when we can offer influenza or COVID vaccines given at any point during pregnancy. And I think it's never too early or never too late to get either of these vaccines. So the new recommendations are really around ensuring that pregnant breastfeeding women are appropriately included into trials, because the major thing that happened, the first JCVI recommendation not to use it in pregnancy was because pregnant women hadn't been included in the trials. So, really we need to get that, we need to make sure that they're included appropriately in trials, and we rethink that. And there needs to be a re-education of meds in pregnancy. We need a pragmatic approach to prescribing, and we shouldn't have this blanket ban, and women shouldn't perceive that no medication is safe in pregnancy. We need to rapidly disseminate updated advice and data concerning new vaccines or any treatments to both women and the clinicians in the future. It really took too long to get the message out, and the processes were really too difficult. So what are my lessons to maternity units? Well, you go back to your unit, just make sure that access to vaccines is easy. COVID and flu vaccines are available now, and we should be making sure that all our women attending antenatal clinic can access it easily. If you can get it into antenatal clinic, it's not something that midwives can just add on to the visit. If you can have a vaccination clinic sitting in an antenatal clinic, as we're lucky enough to have, then I think it really is the best way. We need to reassure and recommend women about vaccination. There's a lot of misinformation out there, and we need to counteract it. We need to explain why, even if they don't have underlying conditions, why they should be vaccinated, what the benefits are, and it's there to protect them as well as to protect their baby. This is everyone's responsibility. It's not just the midwife's responsibility. It's not the GP's responsibility. When we see women in an antenatal clinic, we should be asking about vaccines as often as we test their blood pressure and urine. It really is a fundamental part of antenatal care. And really, let's change the narrative. Women should be taking safe medications in pregnancy and avoiding unsafe medications, not avoiding all medications. Again, these are not new recommendations, just to move on, but it's really imperative that the clinicians in all areas of the hospitals are made aware of the evidence-based guidelines. We saw problems with women with COVID, and it's reflected on other medical conditions as well. When they weren't in the maternity unit, that people weren't using the correct guidelines and people weren't getting the right medication. We should also be able to know who to call if we don't know what to do. And there's a multidisciplinary maternity team that should be able to help with these complicated women. And also we now have maternal medicine networks where we can look for assistance in providing advice and care. So my last slide is shared by permission. This is the baby of one of my midwives that I work with who I delivered. This is her son. She had 2 doses of AstraZeneca when she's pregnant. And I use it to remind people that vaccination is safe in pregnancy, COVID and flu are not. Her caption for it is, hands up if you have antibodies. Thank you.